98% of sleep apnea patients have low vitamin D, the hidden connection explained. Sleep apnea has become one of the most common yet underestimated sleep disorders worldwide. Millions of people struggle with interrupted sleep, loud snoring, fatigue, and poor energy, but very few realize that a vitamin deficiency could be at the root of the problem. Recent studies show that about 98% of people suffering from sleep apnea have low levels of vitamin D. That's an alarming connection worth understanding. Let's break this down step by step and see how vitamin D affects sleep, breathing, and overall health, and what you can do about it. Step 1. What is sleep apnea? Sleep apnea is a disorder in which your breathing repeatedly stops and starts while you're asleep. The most common type is obstructive sleep apnea, OSA, where your airway becomes partially or completely blocked during sleep. This leads to poor oxygen supply, snoring, and frequent waking up throughout the night, often without even realizing it. Common symptoms include loud snoring, gasping for air during sleep, daytime fatigue, morning headaches, difficulty concentrating, mood swings. But what does vitamin D have to do with all this? Let's see. Step 2. The vitamin D connection. Vitamin D, often called the sunshine vitamin, is much more than a bone-strengthening nutrient. Plays a vital role in regulating your immune system, reducing inflammation, balancing hormones, supporting your sleep cycles. Research now shows that a deficiency in vitamin D can directly affect your breathing, throat tissues, and even your ability to get deep, restful sleep. Step 3. How low vitamin D causes sleep apnea. Here's how low vitamin D levels affect your sleep step by step. 1. Inflammation in throat and sinuses. Vitamin D helps reduce inflammation. When your body lacks it, the tissues at the back of your throat and nose can swell, narrowing your airway, one of the main causes of snoring and breathing obstruction at night. 2. Overactive immune system. Low vitamin D can make your immune system overreactive. This increases inflammation in your sinuses, throat, and even lungs, making it harder to breathe freely while sleeping. 3. Poor sleep quality. Vitamin D helps regulate your sleep-wake cycle, circadian rhythm. It supports deep, delta wave sleep, which is crucial for body repair and mental rest. Without enough vitamin D, you may toss and turn at night, wake up frequently, feel tired even after long sleep. 4. Snoring and teeth grinding. People with vitamin D deficiency are more likely to snore loudly or even grind their teeth, bruxism. This happens due to stress imbalance and muscle tension in the jaw and neck. 5. Increased stress and cortisol. Low vitamin D is linked to higher cortisol levels, the stress hormone. High cortisol disrupts your natural sleep pattern, keeping your body in fight or flight mode even when you're resting. Step 4. Other problems linked to low vitamin D. Apart from sleep apnea, vitamin D deficiency can cause low back pain, making it harder to sleep comfortably, muscle cramps and leg pain, fatigue and depression, weak immunity, insulin resistance, which affects energy and weight. So, if you have both poor sleep and low vitamin D, your overall health may quickly decline. Step 5. The right way to take vitamin D. Health experts recommend the following steps for managing vitamin D deficiency. Take vitamin D3, not D2. Vitamin D3, cholecalciferol, is the natural form made by your skin from sunlight. Vitamin D2 can actually disturb sleep or cause insomnia. Take 10,000 IU daily before bed. This amount supports deep, rejuvenating sleep and helps with airway inflammation. Always consult your doctor before high-dose supplementation. Combine with magnesium. Magnesium helps your body absorb vitamin D better and prevents muscle cramps during the night. It also helps you relax and sleep peacefully. Spend time in sunlight. Natural sunlight is the best source of vitamin D. Aim for 15 to 20 minutes of sunlight daily on your skin. Step 6. Vitamin D and insulin resistance. Low vitamin D is also closely tied to insulin resistance. a condition that affects blood sugar balance. When insulin doesn't work properly, it leads to fatigue, weight gain, poor sleep quality. Vitamin D helps protect the beta cells of your pancreas, which produce insulin. So, maintaining healthy vitamin D levels helps your sleep, energy, and metabolism all at once. Step 7. How to improve sleep apnea naturally. Here's a quick checklist. Get your vitamin D level tested. Ideal range, 50 to 70 ng/ml. Take vitamin D3 plus magnesium daily. Maintain a healthy weight. Avoid alcohol and heavy meals before sleep. Try sleeping on your side, not your back. Keep your bedroom cool, dark, and quiet. Conclusion: if you suffer from snoring, restless nights, or sleep apnea, it might not just be a breathing issue. It could be a vitamin D deficiency silently affecting your sleep and overall health. Improving your vitamin D intake is a simple yet powerful way to reduce inflammation, improve breathing, sleep deeper, wake up more energized. It's time to fix your vitamin D and let your body heal naturally while you sleep.